Duchenne muscular dystrophy, or DMD, is a genetic, X-linked progressive muscular disorder. According to the Centers for Disease Control and Prevention, nearly 14 in 100,000 males are affected by DMD in the United States. And according to Salzberg et al. In 2018, nearly 25 in 100,000 worldwide. As a result of the absence of dystrophin protein between the sarcolemma and the outer layer of the myofilaments, muscle tissue is progressively wasted and replaced with scar and adipose tissue. Patients with DMD lose the ability to move and function as muscle contractions progressively get weaker. The cause of death for DMD patients is the failure of cardiac and pulmonary muscles to contract. With no existing cures for DMD, it is important for the healthcare industry and pharmaceutical companies to adopt aggressive, equitable approaches to treat this lethal disease that claims thousands of lives every year. While progress is currently being made, the failure to discuss the impact of race inhibits the ability to adopt an equitable approach for all people affected by DMD. Today, we'll be discussing the role race plays in DMD diagnosis, as well as access to healthcare and prevention for DMD patients, focusing specifically on the United States. Race has long played a significant role in diagnosis of genetic diseases and has long been an unfortunate obstacle to accessing adequate, equitable healthcare. According to Williams and Cooper in 2019, immigrants from all racial groups have a lower life expectancy than their white counterparts, with the most notable being non-Hispanic white Americans having a 3.5-year life advantage compared to African Americans. This racial disparity is also highlighted in diagnosis for DMD. According to Holzer et al. In 2011, after analysis of the diagnostic process for DMD, white boys were given creatine kinase tests, a diagnostic tool for DMD, an average of 12.9 months sooner than Black and Hispanic boys. In addition, white boys were given DNA screening tests, an average of 24.5 months earlier than Black and Hispanic boys. Early diagnosis is crucial for creating a better quality of life for DMD patients. With early diagnosis, patients live statistically longer than patients with delayed diagnosis, according to Ozturk et al. In 2014. Patients with early diagnosis have access to early mitigating treatments such as corticosteroids and gene therapies. This delay in diagnosis only exacerbates the struggle patients have living with DMD. Ozturk et al. In 2014 notes that this disparity goes beyond diagnosis, as African Americans utilize healthcare services 50% less compared with whites and 70% less compared with others, and this concerns African Americans and all Americans dealing with muscular dystrophies. Despite utilizing healthcare resources at a significantly lower rate than white Americans, African Americans have on average about 1.5 times as many ER encounters as whites and other races. They are also twice as likely to be hospitalized as other race groups due to muscular dystrophy. Without equitable access to healthcare, there's a greater risk that DMD patients from minority backgrounds face compared to their white counterparts. Adjusting for population differences, Rometty et al. In 2015 finds that the prevalence of DMD in the United States is roughly the same across all race boundaries, yet access to healthcare remains a barrier to improving quality of life. Underrepresented minorities with DMD face challenges that are unmet in the current discussion of DMD treatment. Delayed diagnosis and lack of lifelong healthcare has led to a decrease in the quality of life and a shorter expected lifespan. Due to inequities in the healthcare system, the story of minority DMD patients differs greatly to their white counterparts. Lack of quality healthcare services in underrepresented population and institutionalized racism permeates throughout the United States. In order to treat all patients equitably and to give them the best chance possible, it is imperative to close the healthcare gaps by addressing the direct needs of underserved populations instead of using a broad brush. Personalized medicine needs to be personalized. This means standing up for all peoples, regardless of race. Together, that's how we can move forward in the fight to cure DMD.